And with engagement, what a great way to lead off. We are going to explore all of these foods and engage with them in lots of different ways. So with telehealth, it's been pretty cool because I do quite a lot of drawings. I am a terrible artist, but the kids just really, really love it. My nice little Cheez-It squares make Cheez-It trains, and they make their Cheez-It trains on the other side, and we chew, chew, chew right along the way. And it's really fun because you can have one of the kids I'm working with right now too, he has little Teddy Grahams, and we always kiss the Teddy Grahams goodbye before they get onto the train. So we are actually interacting with our lips with the teddy bears because he's kissing them goodbye. But when we first started, he didn't even want to look in the bowl. We were not even wanting, no, I can't do it, can't do it, can't do it. And that's something that we hear a lot. I have one kiddo that Hyland and I share, and he's just the funniest kid. I just love him to death. And he goes, nope, can't do it. That's yucky. I know that's yucky. And then we say, we're still learning. We're still learning. He goes, yeah, you're learning it's yucky. And we just keep telling him, like, I know blueberries are different. Blueberries sometimes are sour. Blueberries sometimes are sweet. Blueberries are blue on the outside, and sometimes they're a little bit scratchy on your tongue. And sometimes when you put them in your mouth, they pop, and you feel that liquid go in different places. So think about how hard it is to eat a blueberry. It feels like a ball. It can be really, sometimes when they're getting a little bit towards their expiration date, they start to get wrinkly. They can be mushy on the inside. They can be really sour. They can be really sweet. This is why our kids stick with Cheez-Its. Cheez-Its and Goldfish, they taste the same every single time you eat them. Nothing ever changes. An apple tastes different. You can get a green apple versus a red apple. Sometimes that red apple is really good. Sometimes it's brown in the middle and it doesn't taste good. We know that it's just that particular piece of fruit, but our kids feel one bad experience can feel like every single time they eat that blueberry, it's going to be bad. So why would I try that? So what we do is we start to help them explore foods. So we start our sessions a lot with, what are we learning about today? So some of our kids start to say, today I'm learning, and they start telling you exactly what they're learning as soon as you pop on the Zoom screen. And it's probably one of my favorite things ever. They tell you everything that's on their plate. And then we start to work on moving up the hierarchy. So you start with just visually having it on your plate. Can you visually tolerate it there? If not, that's where we're starting. If you can't have it on your plate, can you have it in the room? Can it be next to your plate? Or can it not even be in this room? If it's not even in this room, like that's that's difficult, right? You're just slowly trying to get the food a little bit closer to the child. Can they touch it? Do they poke it with their finger? Will they poke that apple? Poke, poke, poke. Will they pick it up and play the drums? Boom, 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 boom. That's an important thing to do, right? It's fun. It's movement. They might even not realize they're working with food at that point. I'm working with one family right now, and I just showed them that's an apple. I was like, just take the apple and play the drums. He loves the drums. Boom, boom, boom. Little kiddo picks it up. Boom, 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 boom. He played with it for 25 minutes, and then at the very end, kind of like, that's interesting. Touched it to his tongue, was like, nope, and then kept playing the drums, but that's okay. Right? That was one exposure where he touched it to his tongue and he explored. The first thing often parents want to do after he touches it to his tongue is like, just take a bite. We don't want to do that. Take the touch of the tongue to the win. That's a win. That's a huge win in therapy, right? We brought out apples for the first time. He touched them. That's a win. He looked at them and he played with them. That's a win. He started to put it up towards his mouth. That's a win. Can he get it to his lips? With a kiss, that's a win. And so we're slowly moving up and we're making it really, really fun. Sometimes I will show videos to my kiddos to show them what other animals look like eating the food too. And we talk about blueberries, and blueberries are wet and they're a little bit mushy. What does it look like on the inside? Show me what your blueberry looks like. And they show their blueberry and they talk about what their blueberry looks like. And so it's just a fun way to explore and become less sensitive overall to what's on your plate and that worry piece. We want to make sure they're not worried. So we're not going straight from the plate to their mouth. If they pick up something that's new, fantastic. Let them eat it. They can eat it. It's fine. If they don't do it, then you don't want to expect that as well. So it is okay. A lot of times our families don't want to waste food. We understand that that can be a concern. So we always sometimes say, just take something that's on your plate for dinner and save it for later, right? Like not all the time does everything get eaten every single time that you have leftovers. So you can save little tiny pieces and use them later on, but it is important that they get exposure and they learn how to play. You can roll an orange, you can scratch an orange, you can throw an orange up like a ball, you can put an orange as a hat. So there's lots of ways that you can play with that orange before you cut into that orange. And a fun way to do it also is have them having part in the activity too. So maybe they can cut the orange and you can help them safely do it. Or maybe you have fun little kid ones that they can practice with you. Maybe you poke the orange with the fork and you pick it up and then you pull out that fork and you smell it. So you're interacting with the orange and everything in all new ways. So we are going to go based on what your child's skill level is with each individual food. It'll all be different based on the color, the texture, the smell, the feelings of it, right? Is it sticky? Is it smooth? Is it something that they can pick up and it doesn't really feel like anything and it just feels like a ball? We're going to go based on what your child does with each food.
Yeah, I think those are fantastic examples too, Nikki. And I think it's also just important to note too, that a lot of this progression of this kind of hierarchy that Nikki mentioned with the touching, smelling, tasting, licking, and then ultimately biting and chewing the foods is based in development. This is how we all learn about foods. And so it is important that for some kids, they can go straight from touching to chewing. For some foods, they can go to touch, to smell, to touch, to, oh, I don't even want to touch it. So it's important for us to also honor the importance of development when it comes to this. We recognize wholeheartedly that this can feel painstaking because we know how important feeding and eating is to everyday life. It is one of the most important, I would argue, occupations that we engage in, and we have to do it every day. We have to eat. We have to feed ourselves or be fed or whatever that looks like. And so it's really important that we honor the independence that comes with a lot of these different steps and recognize that these are the steps that maybe your child is missing by not avoiding foods altogether. And so this is why we really do determine what's the meal, what's the mealtime at home, and then what is the treatment meal, because the treatment meal is really taking each of our kids through this, because the focus isn't on volume or intake. The focus is on exploration and really working through these developmental steps. As we lay a solid foundation, then you're going to see that your child's going to require a much less prompting when it comes to, now we're going to touch it, now we're going to smell it. They're going to do that automatically. Like Shana mentioned at the beginning, feeding and mealtime is learned. And so these are sometimes, even with our much older kiddos, they've never fully learned what it means to eat. And so this is how we can teach them. And so absolutely, sometimes it looks like we're just messing around, but in actuality, there's a lot of really important learning and successes that come in exactly what Nikki mentioned.